Firstly, it's access for our patients and families and the referring physicians who send children here to the Heart Center program at Packard. Right now, we constantly have a problem being able to get enough bed space in our current CVICU for all the children who need cardiac intensive care. In fact, on a daily basis, almost, or weekly basis, we're having to cancel operations here because of lack of access. So from expanding our current bed number from 12 up to 20, we'll be able, we think, to deal with the problems of access that we have. Secondly, we wish to be able to cohort together children who have cardiac disease and need critical care more into one space. Right now we have primarily post-operative patients in the cardiovascular ICU. What we would like to be able to do is bring together all the children who need critical care for cardiac disease into one space. Some of them right now are staying in the neonatal intensive care unit. Many of the preoperative newborns are there, and also children who have heart failure who are older. Many of them have to stay in the pediatric ICU, again, because of lack of space in our current unit. So to bring together medical and surgical patients with cardiac disease into one place where all the expertise lies. And lastly, our subspecialty uses a very significant amount of technology, and we wish to be able to have more space, to have our devices and our machinery deployed properly instead of having it stored, for example, along all the hallways and in places that it's not really designed to be stored in. And so it's to get access for more space for our equipment as well. The new CVICU, which will be a 20-bed unit in comparison to our current 12-bed CVICU, will have 2 to 3 times the amount of space for the care of our patients. So it gives us an opportunity to be less crowded, to have more space to work around the children when they're in their bed spaces. And in addition, it has in the back of every semi-private room, and again 13 of the rooms are semi-private, there is a space specifically for parents to sit or even lie down. It's a bench, if you will. And we've never had the ability to have parents, other than to bring a chair to the bedside, actually sit or lie down and rest during the intense times that they have with their children in the unit. And this is a tremendous improvement for family-centered care, which we practice in the CVICU. Well, the Heart Center program here, as it exists now, was started in 2001, and the CVICU was opened at that time. I arrived in 2003, and we have been able to grow our faculty and start a fellowship program, which now has 3 senior fellows in cardiovascular intensive care here just at Packard, which is one of the largest in the country. And I think that as we have grown and developed and our reputation has spread, we've gotten more national recognition. For example, last year in the new U.S. News and World Report, the Heart Center program here was ranked number 5 in the country of all children's Heart Center programs. The only ones ahead of us now are the very well-established large programs that have been in existence for decades. So I think we've made rapid progress in that. And just specifically within the realm of pediatric cardiac surgery, our mortality rates now early after surgery are well under 2%, and in 2005 and 2006 the pediatric cardiac surgical mortality rate in our program was the lowest of all hospitals in the Children's Hospital Corporation of America survey, which is over 40 children's hospitals, at again less than 2%. And so I think we have achieved as a Heart Center a very significant amount of success, especially in our cardiac surgical program, and the CVICU is an integral part of that program.